Welcome to Public Health on Call, a podcast from the Johns Hopkins Bloomberg School of Public Health, where we bring evidence, experience, and perspective to make sense of today's leading health challenges. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes.
The world has never seen war like this before.
I can use your face to call for genocide.
New weapons.
I think the new age of conflict is definitely going to be across ones and zeros, and it's not necessarily going to just impact warriors on the battleground.
New conflicts.
Nowadays, we receive nearly 3,000 patients on a daily basis.
And new challenges.
A freeze on foreign aid continues to cause confusion and spread fear among humanitarian workers.
Go to the front lines, behind closed doors, and explore the conflicts tearing the world apart and the projects keeping us together.
Because you never know when war may reach your own borders.
Only on Intercross, a podcast from the International Committee of the Red Cross.
It's Lindsay Smith-Rogers. Today, humanitarian aid in Gaza and beyond. Dr. Paul Spiegel is the director of the Center for Humanitarian Health at the Johns Hopkins Bloomberg School of Public Health. He speaks to Dr. Josh Sharfstein about the historic principles of humanitarian work, the controversy surrounding the Gaza Health Foundation, and the transformation needed to provide aid more effectively to people in need around the world. Let's listen.
Dr. Paul Spiegel, thank you so much for joining me today on Public Health on Call. We're going to talk about humanitarian health and the situation in Gaza. But before we get into it, I'd like you to remind me about your work in humanitarian health over the years.
Certainly, and it's a pleasure to be here, Josh. So I started over 30 years ago with NGOs working with Doctors Without Borders and Doctors of the World in various, mostly refugee camp settings. I then eventually joined CDC, and I was working at their emergency refugee health branch for about 4 years, and then ultimately seconded and then worked for UNHCR. I was running their public health programs and eventually a deputy director as their head of their technical programs. And then finally, about 9 years ago, I rejoined Hopkins, where I did my residency in preventive medicine and my MPH to direct the Center for Humanitarian Health.
So it would be fair to say you have a lot of experience in this field of humanitarian health.
I would think so. Some would say perhaps too much experience.
Okay, well, we'll get back to that. Talk to me about some of the principles of humanitarian health.
There are 4 key humanitarian principles: humanity and impartiality. And then there are 2 other principles that are neutrality and independence that actually are being more and more challenged in the way that conflicts are occurring. And as we move from more of an international humanitarian architecture to a more national and local architecture.
Tell me first, though, about those principles. Why were they developed? Why do you think they're important?
They were developed primarily with the International Committee for Red Cross, and then continued and evolved with then the broader Red Cross, Red Crescent community with the International Federation for Red Cross and Red Crescent, and then ultimately adopted by the UN and the international agencies. And the reason why they're so important is because responding to humanitarian or doing humanitarian work is very different to development work, where in development work, you are part and parcel working with the government, the national systems to try to develop them. Where in the humanitarian system, it's quite different. Often you may be working with a government, you may be working with non-state actors, and the goal is, number one, is to try to help everyone equally and in an equitable manner, hence the humanity and impartiality, but also to remain neutral. And the neutrality is very important so that you are able to work on both sides of a conflict, because the idea is that you want to help anyone who is vulnerable, and that in many situations in the past, it was mostly external conflict, one country against another, and you wanted access anywhere to be able to help sick people. And then finally, the independence relates as well to ensuring that the neutrality and the independence are goals to be able to allow humanitarian actors to gain access to anyone who needs care on any side of the conflict.
Now, you mentioned that those principles are harder these days as conflicts become local. What did you mean by that?
For two or three reasons, I would say. Number one is that it depends on an organization's mandate. So the International Committee for the Red Cross under the Geneva Conventions has a very clear mandate, which is to help all sides of a conflict. They can be combatants who are unarmed, civilians, and they also have access to wounded combatants. They are able to get into prisons. And so they started as principles, as I mentioned before, to ensure that everyone has access to all sides in an impartial manner. But as time has gone on, more and more conflicts, number one, have become internal. They've been either civil wars or there has been what's called asymmetrical conflict, which means you're fighting terrorist organizations like ISIS. And so, for example, in those situations, one was not able to work on both sides. One could only work, for example, with the Iraqi government, and there was no contact with ISIS. But then as we move towards local organizations are often working in their communities, and they are not working, and nor do they have any desire to work on both sides of the conflict. In many ways, they wouldn't. So if you look at the current Israeli-Gaza conflict, you're not going to be seeing local organizations in Gaza or local organizations in Israel working on either side. And therefore, these issues of neutrality may not be always relevant to those organizations in the same way it may be to international organizations.
Well, these issues have now broken into the headlines as relief efforts in Gaza have been changing. Could you explain to me what's going on?
Gaza, as always, seems to be incredibly polarizing, and it is challenging many of the principles, but also other aspects in how we do humanitarian assistance and also international humanitarian law. So in the past, what has happened is UNRWA, the UN Relief and Work Agency, has been the UN agency on the ground for decades and decades. And they work as almost a quasi-Ministry of Health for the registered refugees as well as ministries of education, a quasi-government. And they work very closely with the Palestinian Red Crescent and many other local NGOs. And what has happened over time is Israel, for many, many years, has had strong concerns about UNRWA and their neutrality, and therefore Israel has been doing its best to undermine UNRWA for decades. But it has become even worse now since in the current crisis, number one. Number two is that there's been concern that there have been allegations by Israel and the U.S. government that Hamas has been stealing goods and using it for their own purposes or not providing it to the civilians in Gaza. It is not unusual for some humanitarian assistance to be deviated through either corruption or through military use in any situation. But to my knowledge, and I'm quite certain about this, there has not been any credible evidence that there has been widespread corruption or deviation by Hamas for these goods. But for those two reasons, I think, as well as some other reasons that we may get to, the Israeli government together with the U.S. government, and there's been some question about they're working together or not, but I think it's quite clear they've been working together. They developed an NGO called the Gaza Humanitarian Foundation. It's a new foundation. It was accredited in both Switzerland and in the United States. And the idea of this foundation was to be able to provide aid in a very different way than we've been doing it in the past, which is in a very militarized way, where there would be a limited number of aid points. The Israeli government would not be in those aid points, but they would be surrounding the aid points to ensure that there was security. But as you can imagine, the Gazans would not particularly appreciate that, and many would be very scared to be able to go there. And then they would be limited numbers, and they would only be in certain areas. And those areas, for the most part, happen to be where the Israeli government wants the Gazan population to move to, which many of us have concerns about, is forcing people to go into areas and forcing them to be displaced, which is, again, against cardinal humanitarian principles and rules.
Now, I read that the head of this foundation resigned just as the work was starting. Do you know what happened there?
Yes. So that was Jake Wood. What happened is The Gaza Humanitarian Foundation, and I have their document in front of me, they mentioned very, very clearly that this is going to be principled action, that it's going to follow all of the humanitarian principles of humanity, impartiality, neutrality, and independence. But it became very clear, I think, to all of us that this was not going to happen as soon as we understood what this organization was planning to do. I think it became clearer to Jake a little bit later that in the way that they were trying to provide this assistance in very, very close collaboration with the IDF, which is now controlling most of Gaza, with very, very few points having to go through checkpoints, that this could never be done in a humanitarian and principled manner, number one. Number two is, I don't know if he understood this or would admit to this, but there already is a system that functions very well in Gaza that has over 400 points, which is a much more traditional way to provide food to everyone, including vulnerable populations.
And so he left and some other people left, and it's caused all kinds of different repercussions for various organizations in the United States. But in the meantime, these access points are proceeding. We're seeing some violence outside of them.
It's the opposite of what one wants, which is to provide food to innocent and vulnerable populations. Some food may be getting there, but people are being killed while trying to get that food. There's a lack of clarity of who is actually causing these deaths. Most of the evidence points towards the IDF, but it's really, really difficult to understand, and both sides are making different claims. I would add that the UN and the international NGOs refused to work with the Gaza Humanitarian Foundation from day one. And part of their fears is exactly what's happening now, is that there are so many people trying to get to a limited number of sites with a limited number of food that it's not the proper way to provide this food. And therefore, sadly, it's not surprising that people are dying while trying just to get life-saving assistance.
So I want to ask you maybe a difficult question. You said at the beginning, some people may say you have too much experience in humanitarian health. And I wonder how you would respond to the idea that, well, the old ways weren't working. Israel is alleging that it was too cozy with Hamas, and that new ways of delivering aid may be necessary in order to help a population while achieving an objective like getting rid of a terrorist organization. How would you respond to that?
Yeah, I think it's a good question, and it's something that I think many of us are struggling with, and I'll try to explain why. We know, those of us that have been in the community for so long, that we know that the current system is not functioning well. It's inefficient, it's not as effective as it could be, and it was developed for a different time. And there needs to be major changes, and they're not just iterative changes. There needs to be a transformation of how aid is provided. And I'm chairing Center for Humanitarian Health Lancet Commission just on this. And we are debating about so many ways to do things differently. And so we do need different ideas. We need different ways of working, including private sector, including probably using tech and AI to move things forward more quickly. And we certainly need local organizations, and we need, whenever possible, national NGOs, faith-based organizations to be much more in control compared to the international community, which does need to step back according to contexts. So there's no question that things do need to change. The problem is they need to change in a well thought through and strategic manner. And that is what I don't think is happening here. I think that this foundation was developed in a deliberate manner to try to undermine UNRWA and to try to undermine not just UN organizations, but the international community without a well thought through way of making sure that it could be done according to humanitarian principles.
And the consequences include people not getting the food that they need.
Yes. I mean, I think we first need to step back and say, well, why aren't they getting the food? And that's because Israel was not providing food, medicine, water since I believe it was March 3rd. And then before that, there have been blockades. But this was a complete blockade, which again is against international humanitarian law. So that's number one. So it was Israel itself that put in these conditions where people are close to starvation. And then putting in Israel, together with the US government, putting in a new system, which was not tried and true, that had no trust of the local population. And the planning of it was very clear, with such few distribution points and with the IDF surrounding them, that it was clear that it wasn't going to work and have humanitarian principles. Again, is an example of how not to do something. And I think this could have been, this was predicted, which is why the UN and the international NGOs did not wish to go along with it.
So where do we go from here?
Well, I think there are two components. One is for Gaza specific, and that is there needs to be food and medicines and water and fuel brought to the civilians in Gaza. The old system, while not perfect, worked very well, and particularly with UNRWA, the Gazans have a huge amount of trust in UNRWA. So number one would be go back to the old system to take care of this emergency, and that's just simple life-saving response. But then secondly, there does need to be, and we're doing this and other groups are doing this, there needs to be a massive change in the way humanitarian assistance is thought through and provided. And this we're working on in a bunch of different ways, and we're not the only ones, of course, but number one would be a significant move from the UN and the international NGOs who control everything, have all of the power and have all of the money. There needs to be a concerted move towards more what we call localization, to the local NGOs, to non-governments and non-state actors, because again, not all governments are helping their own people. What's happening now with the US government's massive reduction in humanitarian assistance and most of the European countries doing the same, there likely will be some sort of shift, and that's primarily because of a lack of funding. But many of us are concerned that that shift will not occur in a strategic and methodological way, but rather just in a reaction to the lack of funding. So there needs to be more. It needs to be changes in financing, changes in governance, changes in some of the way we see humanitarian principles. As I mentioned, some organizations will always need to follow all four of those principles. Humanity and impartiality should be inviolable and should always be there. But other principles, I think, should also be considered, such as do no harm, such as accountability, and possibly even something we're calling allyship, which means that the UN and the international organizations need to make a very concerted effort to help local NGOs and national and local governments, and not try to constantly, although they provide lip service to helping them, end up keeping much of the money and the power and the control.
So more than 30 years in this field, have you ever seen a moment like this?
Never. And I hope, despite the horrific situation that we're in and the pain it's causing for so many people, I hope that there will be a way to transform humanitarian assistance and response to make it more equitable, more local, and help people that truly are vulnerable and need this support.
Dr. Paul Spiegel, thank you so much for joining me.
Thank you.
Public Health on Call is a podcast from the Johns Hopkins Bloomberg School of Public Health, produced by Joshua Sharfstein, Lindsay Smith-Rogers, and Stephanie Desmond. Audio production by J.B. Arbogast, Michael Bonfils, Spencer Greer, Matthew Martin, and Philip Porter, with support from Chip Hickey. Distribution by Nick Moran. Production coordination by Catherine Ricardo. Analytics by Elisa Rosen. If you have questions or ideas for us, please send an email to publichealthquestion@jhu.edu. That's publichealthquestion@jhu.edu for future podcast episodes. Thank you for listening.